everyone, this is Suprava. We will be discussing about neural tube defect. So next, moving on to the signs and symptoms. So there can be loss of bladder or bowel control, and also there might be partial or complete lack of sensation and partial or complete paralysis of the leg. Also along with these things we can see weakness of hips, legs or feet of a newborn. Along with these, there might be other symptoms also. So there might be, abnormal feet or legs such as clubfoot, and there might be also hydrocephalus. And at the sacral region, we can see there would be presence of hair and also dimpling of the sacral region. Next, moving on to the diagnostic tests. So in diagnostic tests, we can do ultrasound. Now, as I told you that, this neural tube defects happens very early in the intrauterine life. It is also, something that can be diagnosed even before birth, right? So here we can do ultrasound and then maternal serum alpha fetoprotein at 16 to 20 weeks. So with this fetoprotein also we can, get to know that if there is presence of neural tube defect. Also along with these we can do amniotic alpha fetoprotein and amniotic acetylcholinesterase. Well, so these were the diagnostic tests through which we can get to know if there is, neural tube defects even before birth. Now coming on to the management. So here in management, there are some general principles that we can say we should follow when there is, a child with a neural tube defect. So the first thing is that we have to position the child in a prone position. Now, why is that? Because, if we position the child in supine position, that would put a lot of pressure on the defect. So to avoid that, the pressure on the defect, we have to position the child in prone position. Well, the next one is if there is any open neural tube defect. So we have already seen in types of neural tube defects that there are several types, right? There are certain types where, the defect might be open. There are several types where the defect might be covered with a thin membrane or with the skin, right? So here, if we have a child or a newborn with an open neural tube defect, then in that case, it should be kept warm. And also we have to make sure that the defect is covered with a sterile, wet saline dressing. And as a part of medical management, we can also initiate the intravenous antibiotic. Next, moving on to the surgical management. So for surgical management, neurosurgical repair is considered to be the, the main treatment for open spina bifida. And if there is closed spina bifida, in that case, it does not necessarily require, immediate surgery, we can say. And, the surgical closure is performed basically within 1 to 3 days of delivery. Well, next moving on to the nursing management. So here the first thing that we would do would be assessment and evaluation of the defect. So during the assessment, the first thing that we would check would be spinal involvement. So how much of the spinal cord is involved, and then if there is any visible spinal defect, so if there is protrusion of the meninges or if there is sac filled with CSF, so all these things we have to check. If there is flaccid paralysis of legs, and then if there is altered bowel and bladder pattern, also along with these things we have to perform the neurological assessment, because we need to know whether the brain functions or whether the function of the spinal cord is impaired, or how much it is impaired. So to know all these things, we have to assess and evaluate the defect properly. And then next, we should monitor if there is increased intracranial pressure. So for example, if it has affected the brain also, in that case there might be increased intracranial pressure, so we have to monitor that. We also have to measure the head circumference, because we've already seen that there are certain types of neural tube defects which is associated with other congenital anomalies, right? So as I told you that there might be congenital heart defects or cleft lip, cleft palate. So all these things, there might be hydrocephalus. So all these things are associated very often. So for that we need to check, we need to see the head circumference also. And then we have to protect the sac with non-adherent moist dressing. So as I told you that, if there is an open defect, in that case, if we place the child in supine position, there would be, there would be pressure on the defect. So we have to prevent that. And to prevent that, we can, place the child in prone position. And also along with that, it has to be covered, as I mentioned earlier. So the defect should be covered well. It should be covered with a non-adherent moist dressing. And then you have to make sure that whatever procedures you are following, you have to, follow aseptic techniques, because as you know that, if there is an open defect, there is a high chance that there might be infection, it might get infected. So we have to prevent that. And for that, it is, you have to, whatever procedures you are following, you have to do, or you have to follow aseptic techniques. And you also have to monitor the child continuously for, early signs of infection. And along with these, you have to make sure that there is, you are administering the antibiotics properly, and you have to prepare the family for the surgery. Well, so if you remember, while discussing about the etiologies, we have seen that, if there is folic acid deficiency, in that case, there is a high chance that the child might get neural tube defects, right? So again, how to prevent it, right? In the prevention, again, it is, the first thing would be that all the women of childbearing age should take a daily supplement of 400 micrograms of folic acid, right? And you know that I have already mentioned that, before conceiving, 1 month before conceiving, and for the first 3 months of pregnancy, they should consume 4,000 micrograms of folic acid. So about the folic acid deficiency, you have to, educate the mothers about the intake of folic acid, and especially in the pre-conception period and also in the first 3 months of pregnancy, how important it is. So you have to educate the mothers about this. And if there is any women who have had the first pregnancy with neural tube defect, in that case, the chances again higher that the second child may also have this defect. So in that case, you have to again, educate them about the folic acid supplement. And other than that, we can do genetic counseling and screening. So these are the ways through which we can, prevent the occurrence of neural tube defects. Well, that's all for today's session. So today we learned about neural tube defect, which is a congenital malformation of the central nervous system, and this results from a defective closure of the neural tube, which happens during the embryogenesis period between 3rd and 4th week of intrauterine life. So this happens very early in the intrauterine life, and it is also, the defect also happens very early, even before the mother get to know that that she's pregnant. So basically, neural tube defects affects the skull, the vertebral column, and also the spinal cord. So there are several types of neural tube defects which we have discussed today, and we have also learned how to manage it. So I hope you have got a better insight about the topic. Thank you.